Allow me to introduce you to Jennifer. Jennifer is a hardworking person. She's dependable and reliable. But when she unexpectedly lost her job, everything started to unravel. She quickly exhausted the little savings that she had and was on the verge of becoming homeless. Her health began to suffer and she found it harder and harder to make ends meet. She became depressed, anxious, and developed stomach ulcers. The stress of it all started to take a toll on her relationship with her friends and family. Jennifer felt like she was in a dark hole that she couldn't escape from. For the first time ever, Jennifer's blood pressure started to rise. To make matters worse, she could not get the care she needed since she lost her health insurance along with her job. However, at this point, even if she was insured, she wouldn't even be able to afford the co-payment. To cope with the increasing financial burden, Jennifer began to drink more and more alcohol, further increasing her chances of premature death. It's no secret that the economy has taken a turn for the worse in recent months. While economists and politicians debate the best way to fix things, the average person is just trying to get by. We all know that a recession will affect our pockets, but the greatest toll may actually be on our health. According to an article from Harvard Public Health, a study of the 1980s oil crisis and recession reported that the chances of dying doubled in the year after the men lost their jobs. Although the risk of death decreased over the years, the risk was significantly higher even 2 decades later. Actually, it is likely that a worker who is displaced at the age of 40 years has a decreased life expectancy of about 1 to 1.5 years. So, what exactly is a recession? A recession is a period of widespread, severe economic decline. It is characterized by a reduction in gross domestic product, or GDP, an increase in unemployment, and a decline in production. Traditionally, a recession was defined as 2 consecutive quarters of negative economic growth. However, this definition is often not enough to determine whether a recession is actually occurring. Plus, significant economic growth that precedes a financial crisis may make it more challenging to identify a recession until it is already underway, even though you may start to feel its effect much sooner. Research shows that the effects of a recession can ripple out into all areas of life. The reasons for this are complex, but it is thought that financial stressors such as job loss or reduced income can lead to poor mental health. People who lose their jobs are also more likely to experience relationship problems or housing insecurities. The stress of financial insecurity can also lead to a wide range of health problems such as anxiety, depression, and heart disease. In addition, when people lose their jobs, they also lose their health insurance. This means that they are more likely to go without preventative care and treatment for chronic conditions. Tough economic times usually also cause a surge in crime and unhealthy coping mechanisms such as smoking, drinking, or overeating. Speaking of toxic habits, check out this video where I discuss the most unhealthy behaviors you should quit as soon as possible. Healthcare costs also increase during a recession as people delay care and end up requiring more expensive treatment. This places a strain on the already limited resources on the healthcare system. According to data from the National Bureau of Economic Research, from the year 1854 to 2020, the average recession in the United States lasted approximately 17 months. If we shift this timeline to the post-World War II period, which is 1945 to 2020, the average recession had a duration of about 10 months. Therefore, even though a recession may technically be short-lived, the direct and indirect health consequences often take years to overcome. So, what can you do to protect yourself from the effects of economic downturn? Number 1, get informed but change your focus. Firstly, it's important to stay informed. Literacy is crucial for improving your health and well-being, but it's equally important not to dwell on negative news. This can be difficult, but focusing on bad news can make you feel more anxious and stressed. Instead, change your focus to solutions and the things that you can control. Remember, this too shall pass. Fortunately, recessions are often followed by periods of growth, so try to stay positive and focus on the future. Next, make sure that you are taking care of yourself physically right now. Eat a healthy diet, exercise regularly, and get enough sleep. Prevention is always better than cure. So make the sacrifice now to ensure that your future self is in the best shape, both literally and figuratively speaking. Check out this video where I discuss physical self-care tips that will transform your life. Don't forget to check the description below to download my free transformational self-care planners. Number 3, stay connected to protect your health. Social support has been shown to reduce stress levels and promote positive health outcomes. During this time of crisis, be sure to reach out to loved ones and stay connected to your community. Doing so will not only help you protect your mental health, but your physical health as well. Number 4, have a plan for the recession. Make sure you have a plan for managing your finances. If job loss is a concern, start by creating a budget and looking for ways to cut back on expenses. Have an emergency fund saved up and stay within your budget. By being proactive about your finances, you can weather the storm of a possible recession. Number 5, work on your resilience and coping. Being able to manage stress is a key factor for maintaining good physical and mental health, and it is especially important during tough economic times. There are many things that you can do to build your resistance and coping skills, including staying positive, setting realistic goals, maintaining a healthy lifestyle, relaxation techniques, and seeking social support. Number 6, cut back on your expenses. Find ways to decrease your expenses. For instance, avoid eating out and cook at home instead. Gardening is also a great way to save some money on groceries and get some exercise. Number 7, seek help if you need it. If you're struggling with your mental health, don't hesitate to seek help. Explore alternative options for health coverage in case you become uninsured. Taking steps to protect your health during times of economic turmoil can help you weather the storm and emerge healthy and strong. What has been your experience with regard to health and financial challenges? Let me know in the comments below. The health of a nation is often the first and last thing to suffer in times of a recession. This has been borne out by the experience of countries around the world over the years. But to really protect yourself, you should be armed with the expert knowledge to take care of yourself. That's exactly why you should check out this video where I dive into the self-care strategies you need to implement right now. If you found this video informative, share it with someone you love. Thanks for supporting my channel by liking and subscribing. Together, we'll navigate our way to a healthier, more fulfilled life, one solution at a time.